You do know it's just a matter of time before something in your mouth breaks and you find yourself away from your dentist or unable to get yourself to any dentist in a timely fashion. So in today's video, I want to go over a few do's and don'ts when it comes to do-it-yourself dentistry. Stick around, I think you'll find these tips pretty helpful. Well, hello again, folks, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the U.S. Okay, so whether it's a broken tooth or a filling that cracks or a crown that pops off, you're going to need to stabilize your situation until you're able to get yourself in to see a dentist. Now, obviously, I know that you're not a dentist, and the thought of treating yourself may conjure up images of Tom Hanks in Castaway, but hear me out. There are things that you can do which will not only help prevent further damage, but they just might spare you some unnecessary pain as well. So keep that in mind. So the first thing I recommend that everyone purchase is a dental mirror. The one I have here is made of plastic, but Amazon sells ones made of stainless steel, just like the ones your dentists use, for only a couple of dollars. I highly recommend these over the plastic ones as they're easier to clean and will last much longer. You can pop these in your dishwasher with the rest of your silverware and you're good to go. Now, they do make dental mirrors with a tiny LED light attached to really help you see exactly what's going on in your mouth, especially in the back upper teeth. These look awesome, but I'm guessing the dishwasher is a big no-no with those. I'll leave links to both types in the description below. Now, these are not affiliate links. These are just the products that I felt were the best offerings. All right, you've got your dental mirror and you've been able to see your problem. Well, now what? Well, let's go over a couple of the most common emergencies that you're likely to see. Up first is a crown or cap that pops off. Yes, these are supposed to stay in place, but every now and then they will come off. The first thing you want to do is look inside the crown. Hopefully, it is all hollowed out without any of your tooth still stuck inside. If you do see some of your tooth inside, well, that would obviously mean that your tooth broke instead of the crown coming off. Now, if that happens, then you're kind of out of luck and a dental visit is needed as soon as possible. But assuming the crown and only the crown has popped off, then here's what you do. First, you need to make sure the inside of the crown is free from any old cement or food debris. Now, the food debris should rinse right off or simply wipe off, but you may need to scrape the old cement off with a small pocket knife or something similar. Second, once you feel that the inside of the crown looks pretty clean, then wipe it down with either an alcohol gauze or some rubbing alcohol on a Q-tip to help kill off any of the bacteria that will be present. Third, try to fit the crown back onto your tooth. Now, it really should only fit one way, which should be pretty obvious, so don't force it down if you're feeling any resistance. Once you figure out how the crown should go, give it another wipe with the alcohol and set it aside, remembering its orientation to your tooth. Fourth, it's time now to get the crown back on. There is a material called Dentemp, D-E-N-T-E-M-P. Also available on Amazon or at your local drugstore. It's not a miracle material by any means, but it can get the job done. You can also use any small tube of denture adhesive like Polygrip or Fixodent. I'll leave a link for these as well down below. Place a small amount of either material inside the crown, filling it up no more than halfway. Dry your tooth with a piece of gauze and without closing your mouth, put the crown back on in the proper orientation and push down firmly with your finger first. Then gently close your teeth together, making sure your bite feels normal and your other teeth are coming together correctly. If all feels well, then hold the crown down again with your finger, wipe off any excess material that should have squeezed out with a wet Q-tip, and then hold your teeth together again for a few minutes to let the material have time to set. Avoid any sticky foods until a dentist can see you, and you should be all set. Whatever you do, do not use super glue. Do not use Elmer's glue, wood glue. You get the idea. Stick to either one of my suggestions only. Thank you. So let's talk about a lost filling or a small chip in your tooth. I'm lumping these two together because these solutions should be similar. We're going to need our old friend D.M.D again. Like before, I want you to gently clean out the hole as much as possible. This might cause some discomfort depending on how large and deep that hole is, but we need it to be as clean as possible. Next, you can use your finger, a small spatula, or that pocket knife again to pack this temporary material into the hole. Work fast before the material begins to set, but don't overfill the cavity. Keep it looking more like a bowl rather than a mound. This next part is crucial, so please listen up. You'll need to start gently biting down and even moving your teeth side to side while staying closed, kind of like this, to push any unwanted excess material out of the way. Like before, if you feel like your teeth are coming together normally, then wipe off any excess material with a wet Q-tip, and you should be okay. The last problem we have is broken dentures. If you wear a denture and you drop it and it breaks into two pieces, hopefully not more, then you do, in this case, have my permission to break out the super glue. But here's the kicker. This is only recommended if the pieces fit back together perfectly with no gaps or openings. If that criteria is met, then run a small bead of glue along both edges, and I do mean small. Connect the pieces and hold them in place until they stay connected. Run a wet Q-tip along the seam to remove as much excess glue as possible, but wait before putting the dentures back in your mouth to allow the glue to set completely. Once that is done, you can put the denture back in, but stick to soft foods until you can see your dentist. Okay, let's finish up with one huge no when it comes to DIY dentistry, and that is trying to clean your own teeth. Now, I can't believe you can actually buy these on Amazon, but you can, and these are pretty legit looking instruments that are called scalers. These are what your hygienist use to scrape your teeth, but they are not for use in untrained hands. Your dentist and hygienist know the proper way to hold these instruments, the proper amount of pressure to use, and the proper orientation to use these instruments so as not to cause any harm to you, the patient. Some of you may be able to successfully remove some tartar, but the risk is just too great. The slightest slip can easily puncture your gums, even if you're careful, but a more significant slip can really shred the soft tissue with ease. My advice, leave these for the professionals. Folks, this should go without saying, but your first priority should be getting yourself to a dentist for proper treatment. However, for those times when it's just not possible, I want you to feel confident knowing that there are ways to stabilize the situation in the meantime. You're not doing anything that isn't reversible or that a dentist won't be able to handle once they see you, okay? You've got this. One final disclaimer here. Just because you did such a good job repairing your situation does not mean that you can blow off making that dentist appointment. I want to be clear about that. Do we have a deal? Well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a comment or question as well, and be sure to hit that bell icon so you can be notified of future videos on dentistry made simple. Bye-bye.